know that under the African Union, our countries have made commitments, but also under the UN Charter, we've made commitments in terms of sustainable development goals, and one of the key components there is universal health coverage, and we will delve more into the discussions of what it is, the confusion between universal health coverage, primary health care, all those we'll discuss, and how the linkages are, and so that when we get back to our countries, we can be able to actually move the agenda. But we also expect that through this interaction that we're going to have this week, that the lessons we draw up, we can actually influence and contribute in our government's position, especially as they meet at the UN General Assembly in September this year.
So we believe in South Centre that universal health coverage is the best enabling framework for tackling antimicrobial resistance. We need to focus on aspects of equity. So how do we ensure that no one is left behind? And also in terms of the global health agenda on the issue, how do we ensure that developing country priorities are right up there with others? How do we ensure that our agenda towards eradicating poverty is included in these aspects? And how do we make sure that sustainability is one of the key elements that we are actually addressing? Not just mentioning, but where are we finding really the resources, alignment that we need both for implementation at national level and ensuring that we have human resources and infrastructure that is supportive.
There are some achievements towards achieving UHC. Some of them are on health governance, where we support countries in collaboration with most of you to conduct situation analysis and to elaborate national action plans. And today, 33 countries have national action plans. We established strength and partnership and collaboration with many actors, FAO, OIE, ReAct, and some others. We link with international health regulation, joint external evaluation, and global health security agenda. Out of the 47 member states part of WHO, all of them are doing something, which is already great. 2 years ago, we have I think 3 countries with a national action plan. So I think that is something commendable.
Antibiotics, antimicrobials at large, are really cornerstones of the basic, but also of the most advanced and modern medicine. Without antibiotics, we wouldn't be able to treat simple wound infections, urinary tract infections, pneumonias, etc. But also more advanced parts of modern medicine, such as surgeries that are now routine in many parts of the world, of hip replacements and organ transplants, as well as cancer treatment, would not be feasible without effective antibiotics. And therefore, with the resistance, antimicrobial resistance, we are really threatening to push this whole pyramid of basic and modern medicine.
And indeed, we all, each and every one of us, need to be part of the global efforts to serve as an AMR watch and to hold accountable our governments, the tripartite agencies, and other national and local healthcare delivery systems responsible for making progress to address AMR. We all own that responsibility to serve as sentinels over safeguarding our future to be one free from the fear of untreatable infections.
So tackling AMR globally is a key priority for the UK. If left unchecked, estimates are that 10 million people annually will die from 2050, and the majority of those will be in low-income countries where the burden of infection is greater. Our current priority is to ensure implementation of the Interagency Coordination Group recommendations on AMR, and that includes full implementation of national action plans, of which the Fleming Fund supports the surveillance aspects. We've just set up an economic fellowship scheme with the Overseas Development Institute, which will roll out over the next 5 years. So this year we're hoping to place 3 economists into 1 health ministries on a demand-driven basis to support developing the economic case for tackling AMR that we all know is so important. Next year we hope to have up to 7 more economic fellows in place. So please do look out for that opportunity if it's something that would work in your country.
Now, the magnitude of AMR, that's really huge. actually we don't have the very precise figures, but we know, for example, from an OECD report that it is predicted that 2.4 million people could die in Europe, North America and Australia because of the resistance. Now, I'm sure that this is much higher in the world, and in particular in the African continent, because we know that the burden of infectious diseases are highest in Africa. And that's why I'm so happy that you are here. You can make a difference. And people count on you. If you go home, really be an advocate for AMR.
Clearly, the AMR threat needs to be elevated beyond health and made part of a larger development agenda in the context of the Sustainable Development Goals, especially SDG 3 on the attainment of UHC. Ladies and gentlemen, the theme of this conference is therefore timely and could not have been better titled as we work towards the United Nations high-level meeting on universal health coverage in September this year. Of course, for us in Kenya, it is very timely because we are already on a journey to UHC. Ladies and gentlemen, as we work through the conference, there is need to recognize and prioritize the need for action to improve health system performance for effective containment of AMR if we are to achieve UHC.
I was very encouraged to see the progress and to see people getting involved into many different actions across countries, even with difficulties, and so that was something that I was very, very encouraged for.
The participation of the teams from the animal health compared to other years. The numbers have grown, and we are also getting to recognize how important the animal health sector and human health sector, how close they are in terms of addressing the common issues with regard to medicines.
This collective energy that we have, there is a lot of engagement in countries, a lot of things are happening, and there is that sort of energy that brushes off. I was able to see that we clearly have champions in a number of countries, and that's very encouraging to me.
Makueni County, that was an amazing story. And when we talk about universal health coverage, we tend to think this is theory, this is like this kind of big concept discussed in high-level meetings. But we have come to see that in Majabe Hospital and in Makueni County, this is possible. I was so much amazed that I think that we should encourage kind of study trips or twinning exercises so that people come to see practical examples of where universal health coverage can be attained, even if it is in one facility or in one county, so that good examples can be escalated in the entire countries. Thank you.
The key word is to mainstream. And it's up to us that are champions here to go back and start mainstreaming these issues, because they are not only pertinent, but they are interrelated. So let's keep preaching to our political leaders, let's keep preaching to our colleagues, and let us try and remove project mode and convert it into programs inside our institutions, so that, and in Africa we have a lot of change in governance structures, in office, in assignments. So we need to mainstream as quickly as possible so that if there's any movement, we don't lose the buzz, but also the momentum.